The following is an unrehearsed interview with Iowa Senator Chuck Grassley, speaking to you live from Washington. Participating in today's public affairs program are Eric McKay with KHBT Radio in Humboldt. Eric, your first question, please.
Okay, thank you for joining me, Senator. Obviously, you voted no on the health care reform bill. You indicated in a conference call earlier this week that you see yourself voting no on a reconciled bill as well. Is there a version of health care reform that exists that you would vote yes to?
Yes. Let me tell you some parts of the bill the President signed, and then some things that aren't in that bill that ought to be in it, and some things that are in it that ought to not be in it. But the emphasis upon preventive medicine in there is very good. Accountable care organizations where you have teams of healthcare people zero in on the chronic diseases, the 5 diseases that eat up 75% of our healthcare dollars. The ban on discrimination of not getting health insurance because of pre-existing conditions. Something that's in there that ought to come out is what's called the individual mandate, where for the first time the federal government, unlike state governments that can require you to buy car insurance, the Constitution doesn't give the federal government authority to tell you to buy anything, let alone very costly health insurance. Things that aren't in it that ought to be in it, it's just a few, but there's many more, and I'll just give you the most important ones, where you have selling of insurance across state lines. Now it's come to me, we got to have medical malpractice reform. I shouldn't have even had to think about that. That's number one for most of us because of lawsuits and defensive medicine and things of that nature that aren't included that ought to be included. One other one would be pools, association health plans, where small business can join in national pools to provide health insurance for their workers, because small business has small pools and very costly. Big pools would make it more competitive and not drive up the cost or make them abandon it just because they've had somebody get cancer, say, for instance.
This week, President Obama announced that he himself would be enrolling in the health care plan. I know that's something that you've been championing for everyone in Congress and elsewhere to do. Wonder if you could give me your reaction to that, just some thoughts on his decision this week.
Well, you know, he didn't do that until I introduced an amendment saying that if Congress is going to be covered, the White House and cabinet people ought to be under the same exchange. And so he says, well, he would do that. Well, the exchanges really don't begin till 2014, so he'd have to be reelected. But he's doing it voluntarily, he said. Well, that's nice. I'm glad he is. But the next president comes along and thinks he's got to have something special. Well, I've been a crusader for a long period of time that Congress ought to be covered by the same laws that affect everybody else. In fact, 1995, I got a law passed that requires that. Requires that we in our offices live under the same thing that other the rest of the country lives under. And there were 12 laws that we'd exempted ourselves from. Well, I was going to make sure we don't exempt ourselves from the health care program. So I got that passed for Congress. Now I offered this amendment. It lost last night, but I'm still going to pursue that. If it's good enough for the rest of the country, it ought to be good enough for the president. And I'm glad the president says that, but it shouldn't be the president individually making that choice. He ought to follow the same law we do.
The president, of course, in Iowa, actually speaking as we are right now. You know your constituents in Iowa very well. What sort of reception do you think the president's going to get in the state today?
Well, listen, anytime a president, Republican or Democrat, comes to Iowa, he's going to get a good reception because Iowans are civil people, and I don't need to tell Iowans that they ought to. There's going to be a lot of people that disagree with the president that are probably at his speech, but they're going to accept him cordially. And I would if I were there. He is our president, and you got to honor the office of the presidency. even if you disagree with the policies. And so he'll get a good reception. But I can tell you this, he's coming to Iowa City because there in May of 2007, he announced his health care reform program. And wants to go back to the place where he says this all started. But this bill's quite a bit different. He was never for doing it all in one shot. He always wanted to do it incrementally. He was never for an individual mandate, having the federal government require you buy health insurance. In fact, he belittled Senator Clinton when she had that in her program for health care. And he said he never wanted to nationalize health care. But he didn't really fight the public option when it was brought up. So he's going with a bill that's completely different. I shouldn't say completely, but on very key points, very different from what he campaigned on.
Moving away from health care, the Ag Committee is considering the child nutrition bill this week. What sort of updates and details can you give us on how that bill's going?
It's not very controversial. It spends a little more money, but I think it's a respectable increase, not anywhere near what a lot of lobbyists were lobbying for. And it's going to have in it a lot of things other than nutrition. It's going to have programs to battle obesity in young people. It's going to encourage healthful living, and it's going to encourage farm to the table marketing, more direct marketing and making use of our local products. And so I think it's a pretty good piece of legislation, and it got out of committee yesterday on a unanimous vote.
Excellent. Well, thank you for joining me, Senator. I appreciate the time.
Okay.
Thank you, Eric, for participating in today's Public Affairs program. This has been Senator Chuck Grassley reporting to the people of Iowa.